Hello everyone, welcome back to Pathomed. Today, let us study about Castleman disease. This Castleman disease is characterized by hyperplasia of cells within the lymph node. So, there's lymph node enlargement because of any unknown reason. This Castleman disease is also called as a giant lymph node hyperplasia. The patient presents with enlarged lymph nodes, so also called giant lymph node hyperplasia, also called angiofollicular hyperplasia. So first, let us study about the let us have a basic idea about structure of a lymph node. This is one lymph node having this capsule. This is the outer capsule. These are the trabeculae or the cords of trabeculae. So the lymph node receives lymph from this afferent lymphatic vessel. Afferent lymphatic vessel brings lymph inside the lymph node. So lymph enters, and beneath the capsule there is a subcapsular sinuses. It flows through subcapsular sinuses and through this trabecula. This along the trabeculae are the trabecular sinus, also called the cortical sinuses, and this inner side is the medullary sinuses. Ultimately, all these sinuses they merge and exit the lymph node through efferent. This is the efferent lymphatic channels. So the lymph node, it has a capsule. This is the cortex. Cortex is again divided into outer cortex and the inner cortex, and most inside is the medulla. So the outer cortex are rich in B cells, and the aggregates of B cells they form follicles. These round structures, these are the aggregates of B cells, they form follicles. Inner cortex rich in T cells, that is T lymphocytes. Medulla rich in plasma cells. This is the basic idea about a lymph node structure. So, coming to the Castleman disease, they can be categorized based on the microscopic features into hyaline vascular type. The most prominent variety or the variant is the hyaline vascular variant. So, the hyaline vascular variant, this is the gross image of the hyaline vascular variant. These are round and well circumscribed. These are round, well circumscribed lymph nodes. On cut section, they have solid. I mean, they do not have any cystic or other any component. These are homogeneous solid component. Color can vary from the gray to a light yellow, tan yellow. So in the microscopy, there are many lymphoid follicles. These are the follicles. They are scattered all through cortex as well as medulla. Many follicles scattered, and there's increase in mantle zone thickening. So within this is lymph node having many follicles, and each follicle they have a center. This is germinal center where the cells arise from the germinal center. They move out. This is the mantle zone. Outside is the mantle zone, and to the periphery, extreme last is the marginal zone. So center there is a germinal center. Around it is the mantle zone. Lastly, there is a marginal zone. So in hyaline vascular type, there is hyperplasia in the mantle zone. Hence, the mantle zone appears thickened. This is the mantle zone. This is center is the germinal center. The mantle zone is thickened. This is the germinal center. Thickening of mantle zone is prominent here. And when you zoom in into each follicle, this center, this center is the germinal center, which is smaller in size. It appears atretic, means uh, that means about to disappear, or it gives the appearance of a closure. So atretic germinal center surrounded by these lymphocytes. This germinal center also shows these are cells, large cells. These are the follicular dendritic cells. The germinal center is rich in follicular dendritic cells, and you can appreciate a blood vessel entering into the germinal center. This blood vessel, it is increased pinkishness. This material appears to be increased pinkishness. That means the vessel is hyalinized. So the hyalinized blood vessel entering the germinal center, the small germinal center with this hyalinized blood vessel gives you an appearance of a lollipop. This is the lollipop. Hence, this follicle is called a lollipop follicle. This is called a lollipop follicle. Blood vessel entering the germinal center hyalinized, germinal center is atretic. And also the follicle also shows like concentric layers. These are the concentric layering of lymphocytes in the mantle zone. The mantle zone, it shows concentric layering of lymphocytes. It gives an appearance of an onion skin. See, for example, you imagine this to be a mantle zone. Concentric arrangement of lymphocytes in the mantle zone gives you appearance of an onion skin appearance. And also, the two mantle zones, the two follicles can fuse. The mantle zones fuse. The germinal centers gives you an appearance of twinning, the twin germinal centers. Is also characteristic of this hyaline vascular type of Castleman disease. As I said, within the germinal centers, they are rich in follicular dendritic cells, which are positive for CD21. CD21 is the marker for follicular dendritic cells. It shows positive within the germinal center. And the interfollicular area, that means these are the follicles. In between the follicles is the interfollicular area, which are rich in T lymphocytes. So T lymphocytes, they are positive for CD5 marker. So this image, the first image, it shows you the germinal centers with follicular dendritic cells showing positivity for CD21, and the interfollicular second image, this one, shows the interfollicular area rich in T lymphocytes. T lymphocytes stain positive for CD5 marker. Coming to the second variant, second microscopic variant is the plasma cell variant. Plasma cell variant, as the name suggests, is a diffuse plasma cell infiltration, where in the interfollicular area. This diffuse plasma cell infiltration, it is attributed because of interleukin 6. There is lots of production of interleukin 6 because of some infectious etiology. This interleukin 6 is responsible for this production of plasma cells. The hyaline vascular changes are absent, that is, the germinal centers becoming atretic, hyalinized blood vessels, the lollipop follicle. These features are absent in plasma cell variant, or it can be very inconspicuous. So, this is the microscopic image showing you this diffuse plasma cell infiltration in the interfollicular area. The interfollicular area shows a diffuse plasma cell infiltration. Hyperview showing diffuse infiltration of all these plasma cells. These plasma cells are positive for CD138. So this is a HC marker showing you the interfollicular areas. All these interfollicular areas rich in these plasma cells stain positive for CD138. And as I have discussed earlier, the hyaline vascular type showing you this new lollipop follicle, onion skin appearance, the twinning of germinal centers. And this plasma cell variant, because of dense infiltration of plasma cells because of interleukin 6, these are the two categories based on the microscopic features, the hyaline vascular and plasma cell. This is the classification based on this microscopic features. Coming to the clinical features, based on clinical categories, again there are two types. The unicentric type, unicentric or solitary. That means the name itself suggests a single lymph node involvement. Second variant is the multicentric variant or systemic. That means multiple, multiple lymph nodes involved, like generalized lymphadenopathy. Firstly, let us study about solitary variant, solitary Castleman disease, or unicentric Castleman disease. The most common location being the mediastinum around the heart. This is the most common site for this unicentric Castleman disease. Other locations can be lungs, neck, axilla, mesentery, that is around the bowels. So these are the common locations for unicentric single lymph node involvement. Grossly, again it shows like as I have shown you the gross image in hyaline vascular type. So these are round and well circumscribed. Cut section solid. So round, well circumscribed, solid. Cut section can be gray, and mostly these are large in size, more than or equal to 15 centimeters in diameter. When you cut it, 15 centimeters in diameter. Microscopically, most of the unicentric Castleman disease, they are of hyaline vascular Castleman disease, Hyaline vascular type. 90% of cases are Hyaline vascular type. Because that means they show this lollipop follicles, the center, atretic germinal center with a sclerosed hyalinous bed where the lollipop follicles, the twinning of germinal centers, onion skin appearance. That is the hyaline vascular type. Mostly unicentric Castleman disease, 90% of the cases show this hyaline vascular type of changes. And these are mostly asymptomatic. Patient does not present any other symptoms, only the single lymph node enlargement. Other 10% of the cases are plasma cell type, diffuse plasma cell infiltration in interfollicular area. Because of what? Interleukin 6. Interleukin 6 is associated with the production of plasma cell variant. So where there comes the interleukin, so these associated with inflammatory. So fever, patient presents with fever, anemia, increased in ESR. Labs show hypergamma-globulinemia and hypoalbuminemia. These are the changes where you encounter in a 10% case of plasma cell variant. Other way again, the second category is the multicentric or the systemic Castleman disease. Multicentric Castleman disease or systemic. So mostly, almost 99 to 100% is a plasma cell type, plasma cell infiltration. So the presence with generalized, because it's multicentric, patient presents with generalized lymphadenopathy. The reasons it can be because of abnormal immune response, because IL-6 is involved, abnormal immune response, viral infections, mostly this is HHV8, human herpes virus 8, HHV8, most commonly seen in AIDS patients. This HHV8 virus is responsible for production of interleukin 6. Interleukin 6 is responsible for production, infiltration of plasma cells. So, and also this multicentric disease, this plasma cell variant, this is associated with this Kaposi sarcoma or the HHV8 associated Castleman disease associated with POEM syndrome. What is this POEM syndrome? The patient has multiple entities like polyneuropathy, CNS involvement, polyneuropathy, organomegaly, mostly liver and spleen, like the patient has hepatomegaly, splenomegaly, endocrinopathies, all this hormonal disturbances, M proteins, that is multiple myeloma, and skin change. The patient presents with cutaneous manifestations like glomerular hemangioma. So this patient shows you the skin manifestations of Castleman disease. Skin manifestations in multicentric Castleman disease. Also, the long-term prognosis of the systemic disease, systemic Castleman disease is very poor. It may take up to months to years, and the systemic variant is associated with renal or pulmonary complications. This is a deadly variant, multicentric type. So, thank you everyone. Have a nice day.